Let's talk about that nighttime ritual you never signed up for. Getting up once, twice, maybe more times a night to go to the bathroom. Or how about when you finally get there, and it feels like you're waiting for your computer to boot up just to, get things started. Maybe you've started mapping out every restroom on your errand route. Or you walk away from the toilet with that nagging feeling that the job isn't quite done. If this sounds familiar, you're not alone. This incredibly common and frankly frustrating experience for men as they age often points to one culprit, a tiny gland that's been quietly growing for years. This isn't just a small inconvenience. It's a biological reality that can mess with your quality of life, add a layer of stress to your day, and disrupt your sleep. And it's wrapped up in a ton of questions and, for a lot of guys, a lot of anxiety. What is actually happening down there? Why me? And the big one, could this be something serious? Well, today we're demystifying the prostate. We'll break down exactly what it is, what makes it grow, what your symptoms are really telling you, and most importantly, what to do about it. Understanding your own body is the first step toward owning your health, so let's get into it. So, what is this troublemaking gland anyway? The prostate is a small, soft gland, about the size of a walnut, and it's a key player in the male reproductive system. It's tucked away just below the bladder, and its main gig is producing some of the fluid in semen. To really get why it causes problems, picture a donut. Now imagine a drinking straw going right through the hole. In your body, the prostate is the donut, and the tube that carries urine out of your body, the urethra, is the straw. Simple, right? For most of your life, it's a perfect system. But the prostate has two major growth phases. The first happens during puberty, but the second one kicks in around age 25 and just keeps going. As men get older, this non-stop growth can lead to an enlarged prostate, a condition with the fancy name benign prostatic hyperplasia, or BPH. Let's quickly unpack that name because it's not as scary as it sounds. Benign means it's not cancer. Prostatic just means it's about the prostate, and hyperplasia is simply the medical term for an increase in cells. So BPH is just a non-cancerous overgrowth of the prostate. And it is ridiculously common. We're talking about half of all men between 51 and 60 having BPH. For guys over 80, that number rockets up to 90%. This isn't some rare disease, it's basically a standard part of the male aging process. So what's the deal? Why does this walnut-sized gland suddenly decide to expand its territory? While scientists don't have every single piece of the puzzle, the main drivers are age and hormones. First, age. It's that simple. The older you get, the higher your chances are of developing an enlarged prostate. It rarely causes issues in men under 40, but after 50, it becomes a very common conversation. The second and more complex driver is your hormones. As men age, their hormonal balance starts to shift. A powerful version of testosterone called dihydrotestosterone, or DHT, is a major player here. DHT is what fuels prostate growth during puberty, and it's believed that continued high levels of DHT later in life keep telling the prostate cells to multiply, causing the gland to get bigger. As proof, men who had their testicles removed at a young age for medical reasons never develop BPH, showing just how critical these hormones are. Next up is genetics. If your dad or your brother dealt with BPH, you're more likely to be in the same boat. It seems to run in the family. Finally, your overall lifestyle has a say. Things like obesity, type 2 diabetes, and heart disease are linked to a higher risk of BPH, likely because they can create inflammation and hormonal chaos. A diet heavy on red meat and light on veggies paired with a lack of exercise can also nudge you in the wrong direction. We know the prostate gets bigger, but what does that actually feel like? Well, it all goes back to our donut and straw. As the prostate donut expands, it starts to squeeze the urethra straw, making it harder for urine to get through. At the same time, your bladder has to work overtime to push urine out, which can make the bladder wall weak and irritable. This double whammy leads to two types of symptoms, which doctors call lower urinary tract symptoms, or LUTS. First, you have the voiding symptoms, the ones caused by the blockage. A delayed start, you're standing there ready to go, but nothing's happening. You might even have to strain to get the show on the road. A weak or stop-and-start stream. Instead of a strong, confident flow, it's more of a weak drizzle that can't make up its mind. Dribbling. You think you're done, you zip up, and surprise, a little extra makes an appearance. Second are the storage symptoms, the ones caused by your overworked bladder, frequent urination, feeling like you have to go all the time. Urgency. That sudden, overwhelming, I need to go right now feeling. Nocturia. This is the official term for being a member of the middle-of-the-night bathroom club. Waking up 2 or more times is a classic sign, that not quite empty feeling. You've just gone, but you feel like there's still more left in the tank. And here's a weird twist. The size of your prostate doesn't always match the severity of your symptoms. Some men have a massive prostate and barely notice, while others have only a slightly enlarged one that causes major disruptions. If it gets bad enough and is left untreated, BPH can lead to bigger problems like bladder stones, UTIs, and in rare cases, kidney damage. Okay, let's talk about the big fear, the one that pops into every guy's head when they hear the word prostate cancer. It's completely understandable that when these urinary symptoms start, your mind might jump to the worst-case scenario. So let's be perfectly 100% clear. Benign prostatic hyperplasia is not prostate cancer. The key is right there in the name. Benign. The cell growth in BPH is non-cancerous, and it doesn't spread to other parts of your body. Having BPH does not put you at a higher risk of developing prostate cancer. They are two completely separate conditions that can, and sometimes do, exist at the same time. Here's the tricky part, though. The early symptoms can look almost identical. Both BPH and, in some cases, early prostate cancer can cause a weak stream or make you urinate more often. But prostate cancer often has no symptoms in its early stages. Later stage symptoms might be different, like pain in the back or hips, or blood in the urine. This is exactly why you cannot play doctor on this one. You can't tell the difference based on symptoms alone, and the peace of mind that comes from knowing for sure is priceless. Which brings us to the most important step of all. If you've been nodding along today and recognizing some of these signs in your own life, the single most important thing you can do is book an appointment with your doctor or a urologist. Seriously, don't be embarrassed. Trust me, they talk about this stuff all day, every day. There is nothing you can say that will surprise them. Getting a proper diagnosis is the only way to get the right treatment and rule out anything more serious. Your doctor will likely ask about your symptoms, perform a quick physical exam, and maybe run a few simple tests like a urine test or a PSA blood test. The PSA test helps screen for prostate cancer, but it can also be elevated from BPH, so it gives your doctor a more complete picture of your prostate health. And the good news? BPH is very treatable. Treatments range from simple lifestyle tweaks to medication and minimally invasive procedures. For mild symptoms, your doctor might suggest cutting back on caffeine or fluids before bed. There are medications that can relax the bladder muscles or even shrink the prostate. And for more severe cases, there are all kinds of highly effective procedures that can clear the obstruction. So the story is pretty simple. Your prostate gets bigger as you get older. It's a natural thing driven by hormones. This condition, BPH, isn't cancer and it doesn't cause it. But it does cause a whole host of frustrating symptoms by putting the squeeze on your urethra. And while it's a common part of aging, it is absolutely not something you just have to suffer through. Losing sleep, planning your days around bathroom locations, and feeling constant discomfort is not a mandatory part of getting older. Understanding what's happening in your body is step 1. Step 2, the most crucial one, is doing something about it. Talking to a doctor isn't a sign of weakness, it's you taking charge of your health. With the right diagnosis and treatment, you can manage these symptoms and get back to living your life, without your prostate calling all the shots. If you found this video helpful, hit the subscribe button for more videos like this. Thanks for watching and see you in the next video.